So your camera is dying.
Oh no.
The battery.
Oh, okay. I have another one.
The mic.
No! Also, maybe we should do, before I inject you, some movements.
Okay.
Yeah, okay. Hello everyone. I am Dr. Sheila Derm and welcome to my YouTube channel. So today, I'm going to go through a whole Botox procedure with my model here, Gina. And it's really great because this has been really requested. And so I'm going to go through the benefits of Botox, and then we did some before footage. So then I'll do the before and after and kind of talk about some benefits, what to expect in case you are curious. I did do a Botox versus filler video that should be live on my YouTube, so definitely check that out. That goes a little bit more in depth about the differences between them. But in summary, Botox is actually just a brand name. It's the most common one, it's the most popular one. It's actually the first one that came to the market as a cosmetic neuromodulator. And so this was actually back in the 80s, and so a lot has evolved from now, but Botox is still one of the OGs, but there are other ones such as Dysport, Xeomin, Jeuveau, and there's even more in the pipeline that's coming out that lasts a little bit longer. And so I will just call it Botox just to be for simplicity's sake, but Botox is actually botulinum toxin, and the protein name is actually abobotulinum toxin A. And that's the protein byproduct of the bacteria Clostridium botulinum. And yes, of course, with everything, as you know, even natural things, if you do too much of it, it can be bad. And so what happens is the botulinum toxin goes in and it relaxes the muscle by decreasing the activity of the muscle. And so your nerves actually do end up kind of growing over time, and so that's why it runs out, or you need another kind of session about 3 to 4 months. And so that's how long it lasts. There are some other ones in the pipeline that last a little bit longer, but it really depends on everyone's metabolism. But I would say about 3 to 4 months for the generic kind of forehead crow's feet area. And then I would say in high kind of movement areas, like for the lip flip around the mouth, that doesn't last as long either because it's an area with a lot of movement. All right, so let's kind of go through our model space. And Gina has had Botox for a couple years now. And so we've also done some lasers on her, some fractional radiofrequency with a microneedling, which I love. So that's a skin tightening procedure. So I tell people, you know, you really want to invest in your skin as well. And Botox is one of them, is one that you can invest in your skin as well. Few benefits are it can cause a little bit of lifting, it helps with fine lines, and it's preventative. So people who are usually in their 30s is when I recommend to maybe try it out if fine lines are an issue, or if you're making those really kind of strong faces, and then it becomes kind of preventative at that point, because if you're not really making those lines appear over time, they're not going to really appear down the road, or at least they won't be really etched in. And so that's what we mean by preventative. All right, so Jenny here, again, she has great skin and great contour, but as you guys can see, she does have a little bit of lines, and she is in her like late 30s, mid 30s, and so we are just doing a little bit of a kind of a touch up. I think it's been definitely a long time since she had it, so she doesn't have any Botox, like residual Botox basically. So some areas that usually are the most common for people is this glabella area. And if you could be kind of make a mad face, perfect. You guys can see those muscles there. It's the procerus and the corrugators. And so by relaxing and injecting into those muscles, they actually relax, and people actually don't end up making that like really mad thinking face. And so that's great. And a lot of people who come in later, maybe like in their 40s and 50s, end up getting this line kind of etched in, and it's really difficult to get rid of once they're kind of like in there, because you can't really use filler in this area. It's a danger zone. So I use like lasers and things like that. Another area that is really popular is the frontalis. So let me have you be surprised. Perfect. So you guys see all these kind of muscles here. This is the frontalis muscle, and over time it does create a little bit of those lines, but if you go in and just sprinkle a little bit in here, it relaxes, which is really nice. I tend to use Botox as a lifter as well. So I tend to hit this part really hard and only do a little bit up here. So then there's more muscle here than here. So then you get a lifting effect. And I think that's really, really a nice look. It's a very kind of wide open, awake look versus maybe if you go to someone that's not so experienced, or back in the day, like in the 80s, 90s, we used to freeze people. So you used to put so much Botox here, like 60 units. That's how much it's kind of FDA approved for. I don't even do that. I probably go, well, including everything, I don't even go up to 60 sometimes. Of course, if we add other areas or masseters, we'll go up there, but definitely not here. And before, people used to only do 60 units here, which is insane to me. I only do like a few. So we definitely still want movement. We don't want to freeze anyone. And we want to really kind of focus on this area so this part actually lifts and we get this like lifted eyebrow effect. And I'll put some before and afters right now as well. Some other areas that people like to do and that are like FDA indicated are the crow's feet here. So whenever you smile, we get a little bit of these lines. And so adding a little bit to the muscles in this area can help soften that out. And then let's go into some of the more advanced techniques. So if you go to like a Joe Schmo, I wouldn't recommend it. They'll probably just cookie cut this this area here. So some advanced techniques that I do in my office include, depending on if I feel like the patient needs it or if they say something that makes me think that bothers them. Sometimes if you smell super hard, people have like bunny lines here, those little lines. So I do that area. Sometimes when people smile or just in the static, normal way, I can do a little bit of Botox actually in this area, right where the nostril and that upper lip hit, which is the columella. And hitting that and relaxing that muscle, you can actually get a little bit of a lift with the nose, which is a cool little hack that I love to do. I also do Botox lip flip, which is very popular in my office. I definitely recommend it if you're not really ready for filler, but you want kind of that upper lip to like flip out a little bit and have a nice border, or if you smile and your lip disappears, this is definitely something I do recommend. So it's hitting the orbicularis oris muscle is actually circular here. And so if you just hit it a little bit, you actually get it to kind of turn up a little bit. And it's a really pretty eversion. And this doesn't last very long like filler, but it's kind of like a good little addition. I do that on myself all the time. Some other areas that are really nice to do is like some people have that resting bee face, where if they are just like in a normal state of mind, their mouth is a little downturned and they just look mad or sad. And so hitting these muscles in these areas can actually lift, so then they are like just in the normal position. Some people have kind of a dimply chin, so I can go in and help relax that dimply chin. What's really popular in my office, so people, dentists or you know, some neurologists do Botox in the masseter muscle, this really thick muscle we have for eating, for TMJ. And although I could do it for TMJ, people usually come in because it's for facial slimming. So if you're weakening those muscles, of course you can't put too much because then you can't chew, but if you just put a little bit, enough for those muscles to kind of soften up a little bit so they're not so bulgy, and I'll show you guys some photos, that'll give you a really nice like slimmed look if yours tend to be bulgy. And what's nice is whenever you kind of decrease this area here, your cheekbone actually pops out a little bit. I don't do it on everyone because in some people that are a little bit more mature, weakening this muscle can actually cause a little bit of the gel. So I have to do a full evaluation to see if they are a good candidate. Some other areas include some of those neck bands here, which Gina doesn't have, but I definitely do. And then another thing that I do in my office is for Botox for sweating. So hyperhidrosis, I do it on the underarm or on the hands, feet, butt, knees, whatever. And the thing with this is you don't go down to the muscle. You inject very, very superficially to hit the sweat glands. And it's really interesting because it actually constricts the sweat glands so you're not sweating as much. So I have a lot of guys that are young professionals or in the work field, and they definitely don't want to sweat when they're at meetings. And so I get them done and they don't sweat for 6 months, which is pretty cool. Another thing that I do with Botox is actually almost like a facial, is mesotherapy using like something like Aqua Gold. And that I go around the whole face, and you're injecting it into the depth of the sebaceous glands, the oil glands. And what's really cool about Botox is it actually constricts the oil glands. So you are making it look like you have smaller pores. The redness is decreased, the sweatiness, you just get like this kind of really nice glow that's really nice, and it's from Botox, and then I put some other concoction in there, sometimes with filler, vitamin C, and things like that. And so very, very popular in my office, very, very fun. And so let's get right into it. So I already pre-drew Gina's units based on the muscle activity. You know, some people have stronger muscles here, some people have a shorter forehead, and so everyone's units are different. So, and everyone's muscles are in different places. And so, do I need to alcohol you down, right?
Right.
Okay. So if you guys like these types of videos, definitely don't forget to subscribe and click that notification bell so you don't miss these procedure type videos. All right, so I'm just gonna alcohol down her forehead, her crow's feet. Perfect, and we're gonna actually do her upper lip, which is super fun. Alrighty, and then I'm gonna get her into position. Love it. Make sure I'll bring her down a little bit. Are you comfortable? Do you want your legs out?
I'm okay.
Okay, perfect. All right, so for Gina, again, I'm gonna focus on this area, sprinkle the top here. I'm gonna do her crow's feet and then a little bit of lip flip. Okay, so it's very comfortable. Some people that really don't like needles, or they haven't really done this, the whole Botox injection thing ever, I do numb, just to help with some of the needle pricks that aren't bad, but it kind of just calms down with their anxiety. So I always offer that to my patients. Gina is a strong lady and has done this more than once, and so we're just gonna go for it. But it's nothing wrong. If you end up wanting to get Botox done, definitely ask your injector. I'm sure they should have numbing at the location. All right, perfect. All right, so I don't know if we want to zoom in here to her face. We're gonna try to zoom in. Thank you, Jahira. She's my like social media queen back there. That's okay. I always cut it. And for this, I don't even need to be in it.
Perfect.
Awesome. Okay. So let me have you be mad. Oh, actually, I'm going to mark her. All right. All right. So usually I don't mark my patients because I kind of go with where the muscles are, but I'm going to mark it for you guys. So let me have you be mad. So there's a muscle here, muscle there, and then let me have you be mad again. Great, and then her muscle actually comes up here as well. Let me just grab another one. All right, so I'm gonna just mark this for you guys. I don't usually do this for my patients, but I think it's a good learning tool. So let me have you be mad. Perfect, and so you can see the procerus muscle right in there, and she has a really strong lateral corrugator right there. Let me have you be mad again. So it's really important that your injector kind of knows what muscles to inject and not just like go in the direction, like general area. Because then some bad things that could happen is asymmetry. Well, first you have to make sure that you're not like allergic or you don't have a medical disease that is contraindicated with botulinum toxin. You also, bad things that could happen is if your injector is not really good and they inject you too deep and too low, your eyelid could get droopy. It's temporary, and I've definitely seen it. And I just had a patient today that said that everyone that she went to before me would get a droopy lip or a droopy eyelid. But that's pretty much it. It's a pretty easy procedure. It's just like this asymmetry. If you freeze too much, then you have to live with it for about 4 months. Also, if you get too close to the eye, it can kind of make your eyelids feel kind of weird. One more other thing that I do in some patients is I do one baby unit in the muscle under the eyelid there, and that helps open the eye a little bit. Or for people who have like a little jelly roll, like a thick little belly of muscle under there, it relaxes it. Kind of opens up their eye, which is really nice. Again, that's a kind of an advanced technique. All right, let me have you be mad again. Thanks, Gina. Awesome, and then let me have you be surprised. So here I kind of want to know their maximum point of height, because if I go too low, then she can't like raise her eyebrow, which is not pretty. And then I always have a patient come back at week 2. Let me have you raise your eyebrow again. Perfect. And we are doing baby units here. And then let me have you be happy. Awesome. And then here I'm just gonna doot, doot, doot. Oh, I'm gonna give you a brow lift. I do that too. So if you hit right where this muscle is, right kind of around the eyebrow area, right under it, it can actually, if you are, so this is the orbicularis oris, and this is the orbicularis oculi around the eye. So we are relaxing this muscle. It's also a circular muscle. So if you're relaxing that circular muscle here, this muscle here is going to overcompensate and pull up, like an eyebrow lift, similar to this area. We want to knock these guys out more than these guys and go up. If you go to someone who's not a good injector, they will just freeze the heck out of you, and then you're gonna be so frozen, and then your eyebrows are gonna be low, and we don't want that. And you're gonna be having to pay more money because it's more units. So, let me have you smile. Perfect. So even though I've done this for years and I've done so many patients, I still ask people to smile so I can see their facial expressions. Every injection counts because I'm working on their face. All right, let me have you be mad. Perfect, so I'm grabbing that muscle and let me have you relax. And it's a little ouch. Just like that, perfect. So patients do really, really well. Let me have you be mad again. Perfect, and relax. Little ouch, very good. Perfect, beautiful. I always like to move to the other side so I'm not going over the patient. And let me have you be mad again. Perfect, and relax. Yeah, this one's a strong one here. Fantastic. So usually like no blood is involved. People don't bruise as much as they would with, for instance, other stuff like filler. Okay, let me have you be mad again. Perfect, and relax. Awesome, little ouch. And let me have you be mad again. Perfect, and awesome. Fantastic. Things are looking good. All right, so let me just make sure we are good. 246, 246. And do your forehead first. 1, 2, 3. 1, 2, 3. All right. Alrighty. So again, very easy. She's super comfortable. She's not acting. All right, let me have you be surprised. Awesome, and relax. And I like to do micro droplets here. Awesome. Like almost even nothing. And this one, actually the depth of the muscle matters too. So for these, it's really superficial. For this one, it's deep. For these, it's kind of superficial as well. Because you have to know where the muscle is. It's all about anatomy. All right, so now let me have you be surprised. Great, so I'm feeling that muscle here and you can relax. So little ouchies, very good. Awesome, perfect. And then we'll get her around these sides here. And you can't go too low because then you're gonna go into the cheek muscle and they can't smile. Have to make sure you're hitting the right muscle, because if you're gonna hit the wrong one, such as the DAO in this area or the DLI in this area, they could just have like a cricket smile or not smile at all. So go to someone who knows what they're doing. All right, and then let me have you smile. Perfect. So I look at where her kind of cheek starts and I go above that. And relax, and you have to do it when they are relaxed, or else you're gonna hit that muscle. We are almost done. How are you doing?
Great.
Okay, awesome. All right, let me have you smile really hard again, and then surprised. Awesome, and relax. Little ouchies. And just a tiny bit there, perfect. You are doing awesome, and then smile. Perfect, and relax. Perfect. Love it. All right, now the not so fun part, and oh my gosh, we didn't numb you. Oh my gosh, okay. The lips kind of don't feel the best, but it's gonna be super quick. Okay, all right, just relax, relax, relax. Okay, little ouch, very good. Okay, you are a boss, oh my goodness. Ouch, 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 very good. Going to the other side for that unit. And little ouch, very good. All right, oh my gosh, she's a boss. So, so we did this area here, so it's gonna flip up and look really pretty, and I'll give you guys some updates on that. So that's it, guys. We are all done. That was it. I'm just going to clean her up a little bit again. Little pinprick marks, not so bad. The post-procedure instructions are super easy. Basically, don't lay down for 30 minutes, don't get a head massage, don't wear a helmet, don't wear a hat. And then it does kick in, it does not kick in right away. It starts kicking in about a few days. The maximum kick-in time is 2 weeks, and that's when I have my patients come back for follow-up in case there's any asymmetries, in case they want more, just to see how they're doing. And then after that 2 week, then it slowly starts kind of wearing off at about 3-4 months. Some people can stretch it out a little bit more. It just really depends on your metabolism and how strong your muscles are. For men, I do have to go in with a lot stronger and higher units because their muscles are stronger, especially when I hit this area here. Anyway, I hope you guys found this helpful. Definitely let me know if you guys have any questions. Leave them in the comment section below, and thank you so much.